Hello, I'm Doeun, Director of Do Digital Lab. Continuing from last time, I'll talk about digital dentures. I'll use a couple of cases as examples to explain the advantages and disadvantages I experienced. Material is also important. The picture above shows the trueness. It shows how accurate it is to the real thing. When comparing the scanned data and the actual product, the green color shows that there is almost no error. The difference is plus or minus 0.1 millimeters, or about 0.001 millimeters. It comes out like this. It's almost the same as the copy. This is the biggest advantage of digital dentures. This kind of work was not possible using the analog method. The production lead time is short. The production method is simple. And as the resin polymerizes, there is almost no shrinkage. Some people wonder why the final denture doesn't fit, even though there was good trueness and the impression fit well. This is because of shrinkage during curing. This problem does not occur anymore. The tension definitely gets better. Let's look at a patient case who got digital dentures. Let's look at the retention. This patient is wearing dentures for both the maxilla and mandible. This is the day the dentures went in. It doesn't come off, even with this much movement. So even the patient was surprised. This is a case for another patient. It's a denture made in-house at the clinic. The tension is high that it won't come off even when you pull it with your hands. Especially for the maxilla, it makes a separating noise when it comes off. Wouldn't many people want dentures like this? This is a mandible denture. It's hard to make a mandible denture that makes that separating noise. Even though this patient had almost no ridges, the denture is fixed in and doesn't come off easily. Let's look at the advantages of digital dentures. The production period was short. It also breaks less. These are some of the advantages. It's easy to make the bite impression. You can do light curing. You can make multiple ones at the same time. It also has the advantage of little polymerization shrinkage, so the retention is very good. When I did the design myself, the production time took about 1 hour. It takes about 3 to 4 hours to print. The biggest advantage is the clone. You can make multiples. You can make multiples at the same time, like this. So if the patient loses it, you can make another one for them. Or you can make 2 to 3 so they can have extra. This is an advantage. And since it uses the light curing method, it is easy to repair if it breaks or needs to be supplemented. It's easy to add attachments. What you see here is called a locator. This shows the locator being connected to an implant. A section is light cured and the denture is placed. Resin is added through the hole and cured. Then, after you take it out, you fill in the rest. In the past, there were times when this locator hardened in the mouth and could not be removed. So there are no more of those concerns. It's convenient to add a new locator. It also breaks less. I'll drop a denture now. Even if you drop it, it doesn't break. So, it's less common for patients to drop and break it while washing at home. It's an advantage that there is no polymerization shrinkage. That's why the denture has good retention. It's easy to make the bite impression, too. The impression fits well, but why does it not fit after curing? It's because of polymerization shrinkage. When a denture is cured, if there is thick resin in the middle, it undergoes polymerization shrinkage. That section goes through polymerization shrinkage. So when you cure it in the normal process, the middle section lifts like this. To prevent this, there was an injection system called EvoCap. So if you use the EvoCap, the retention is very good. It is very accurate, but the disadvantage is that it is too expensive. 3D printing has very good trueness with almost no shrinkage. In this patient case, the ridges are good and the bone condition is also good. I did this case first. I'm also testing it myself, so I tried it. I made it like so. At the time, the teeth didn't come out as much aesthetically as I wished. I lacked the know-how. This video is with the denture placed. Since there is a lack of ridges, it can't be taken out. It doesn't come off well. I gained confidence and continued to another patient. This patient had almost no ridges, especially in the mandible. This patient has no bones, and the mouth floor and the buccal mucosa in the mandible are almost attached. I made it in this form. The patient's jaw was also slightly twisted. This was the delivery date. It doesn't come off easily and makes the separating noise when it comes off. Let me explain my workflow now. When the patient first visits, do the preliminary scan. A preliminary scan is done on the first day. This patient has even less ridges. The patient came to see me after hearing about my digital dentures. Most patients are ones who were turned away from other clinics. They seem like impossible cases at first. When you scan for diagnosis, place dots here, like this. I'll show you the software process. You have to make sure that the scan includes the area from the harmular notch to the retromolar pad. After, when you pass this file to the laboratory, the dots are added like this. At the second visit of the patient, when the laboratory is preparing, this is the individual tray and wax rim. From here, it goes through the conventional method. Since you can't make a functional impression with an oral scan. This is because, when you add pressure, you can't select where to add or relieve the pressure. So it's made in the analog method. You can use the method you want to make it. An individual tray is made with the wax rim raised at the same time. The process of making the wax rim is set to the average values. The wax rim is raised using the reference point that is placed 80 millimeters in front of the incisive papilla. And you mark the midline. And you send the digital file to the scanner. This is what the laboratory sees. It's aligning the midline. And use the material you want for the border molding. I like the modeling compound, because selective pressure is possible. And use silicone for the final impression. You don't scan it. After making a silicone impression, scan the silicone impression and send the file. This is what the final scan file that goes to the laboratory looks like. And it's placed on top of the bite. Check that it matches the average values. Check whether 21 millimeters or 18 millimeters is appropriate. Check the vertical and horizontal relationships. and it goes through artificial tooth arrangement. It's all done virtually. When the design is done, it goes to the CAM process, and the base and tooth are extracted through 3D printing. Another way is to make one lump for the tooth and stain just the gum section with pink resin. You can also separate it and make it. I like the method of making it by separating it, because the staining process is not easy. So now, the design is finished. Then, you print it. At the third visit of the patient, the denture is placed. It's not delivered right away. It goes through a process called clinical remounting. Because there are cases where all of the teeth have a supporter on the occlusal surface, the occlusion may not be perfect. And since it takes too much time to adjust the occlusion inside the mouth, you perform clinical remounting, which allows you to check the CR as well. Simply put alu wax on the occlusal surface and take a bite impression. This shows clinical remounting. You do all of the occlusal adjustments here, and at the patient's fourth visit, you do the delivery. Usually, through the analog method, it needs about 7 steps, but it is not too inconvenient to shorten it to about 4. On the day of delivery, you adjust the occlusal a little more. It was placed in the mandible. It has very little ridges, but let's see if there is retention. The retention is so good that it makes the separating noise when it comes off. It's a retention level that is almost impossible with ridges like those. This case would have been impossible using the analog method. I check the retention by putting the premolars like that. There are almost no ridges in the mandible, but the retention is good. This is another patient. Because it went through the remounting, the occlusal fits very well. You deliver it to the patient and check the function. The dentures will have less chance of falling off when talking. There is also a method of making the whole thing using a single material. After you design it like this, you stain the outer surface. There are no problems at all. You can stain it by using pink resin. It's not easy, but it's possible. You make it with the Do-eun P-Max material and attach it with resin. It has become easier to check all of the vertical and horizontal lines digitally. The horizontal line is not straight. A big advantage is that you can adjust all of it digitally. Now, to think about which product to buy. I think, in the end, the material is important. Will the material from this company be compatible with a printer from another company? Not necessarily. You continue to go through a correcting process. The amount of light and curing time differs for each material. It's important to match these things. You can compare the specifications to choose which company product to purchase. What to check in the specification is the precision of the X, Y, and Z axes. The resolution is 65 micrometers on the XY axis and 100 micrometers for the Z axis. This probo you see right now is a little more precise and adjusts to 25 micrometers and 50 micrometers. The size is 124 millimeters by 70.2 millimeters, so you can know how big of a size can be printed at one time. You can also compare how many models you can print out at one time. The product you see is Probo Z, and the size is smaller. The XY resolution is 55 micrometers, and the layer is the Z-axis, which can be set to 25 micrometers, 50 micrometers, or 100 micrometers, so it can be made precisely. I compared to trueness with other companies. The precision of the tooth section is higher with Probo. The precision of other companies has improved a lot too, so it comes down to the material. To improve the strength, more fillers need to be added. When more fillers are added and the compatibility during curing doesn't match, then it gets cakey or stops printing in the middle. It needs to be used in a well-ventilated place. Maintenance is important, and the temperature is also important. If the temperature is too low, it may not cure. And there is a film. It's good to replace it every 1 to 2 weeks before it gets contaminated. Since the light comes out from the bottom and cures, if the film gets dirty, it won't cure well. I'll show you how a film gets replaced. I let the film get very dirty before replacing it. That transparency is the normal state. When you lock it, you need to move it diagonally and in the shape of a star back and forth to lock it tightly. And sometimes when curing, unexpected situations occur, like it falling off like this and nothing is left. This happens because it laminates as it cures. And if it is designed so that the hole at the bottom is clogged, then the liquid resin inside cannot come out and becomes heavy. Then it just falls off. So you have to use cam design so there is a hole. Of course, the cam design at Do-eun right now is set up for this to happen automatically. So, if you are doing it separately and have been seeing failures, you can check if this is what's happening. Some people use a combination of programs from several companies, and sometimes experience absurd things like this. Do-eun's CAM software is made so that everything is set automatically. Also, to reduce the post-processing, the support location must be appropriately placed. Make sure that the important parts are printed precisely. If there are many sprues on the occlusal surface like this, then the occlusal adjustment will take too long. So you should avoid this and add the supports in the marginal area. And storage temperature is important for 3D printers. If it's too low, there is a tendency for the curing to not go well. So store it in a warm place and shake well before use. This is Dr. Alejandro Aguilar Williams, a key doctor of Do-eun. He said, "The patients always want more." Digital technology is an excellent key to better meet the needs of patients. I agree fully with what he said. I hope you continue to look for better treatment methods. It's called multidisciplinary treatment. It's a treatment where various treatment methods are used, and all of your knowledge is used together. For this case, 43, 44, and 45 were attached by pulling together through correction. So this tooth is maintained. VD and CR are determined using the Lucia jig. You can see that it is a bit tilted. So adjust the horizontal line using the pre-preparation scan. I'll modify the provisional. There is a way to modify it in the shape program. Modifying. The blue color indicates the pre-prepared area. This aligned the horizontal line. This is 6 months later. The smile improved remarkably in just 6 months. This is 1 year later. Now the patient has a beautiful natural smile. I hope you think about better treatment methods. Thank you.